Sometimes you'll see babies in the NICU or at least in the ICN because they're too small. They call them feeding and growing just because they need more time to reach a good weight. And a low birth weight is, we think of it as generally less than 2,500 grams or less than 2.5 kilos. That's really small. But why exactly do we worry so much when babies come out too small? I mean, being too big, or LGA, large for gestational age, also has its own problems, but being small is dangerous for a variety of reasons. First, it always makes sense to think about why are they so small. And in fact, one of the logical causes of low birth weight is prematurity. So if they're not term, they're less than 37 weeks, then prematurity also has its own problems. But then since low birth weight is obviously correlated with being premature, a lot of these problems can be the same. So one of the things we have to worry about is their ability to breathe well. The lungs need not only time to mature, but they also need a certain level of maturity to develop surfactants. This is the material on the surface of the alveoli to not only lubricate but also support them as they expand and collapse. And usually in babies who are not term, respiratory maturity is a big problem. So the lung disease that we worry about in premature infants is called respiratory distress syndrome. This very rarely occurs in term infants. So when we talk about RDS, it's almost like we're always talking about prematurity. So with RDS, it might be difficult for their lungs to breathe and for their central nervous system to coordinate the breathing. So they can have apnea, the lack of breathing, which is very scary for babies, and that's why they need constant monitoring. And in fact, if they have severe RDS, a lot of these babies are intubated, just so that we can make sure that they breathe for the first days to weeks until the rest of their body catches up to breathe independently on their own. So whether it's intubation or supplemental oxygen, we keep a 24-hour monitor on their oxygen level. And like I said, their growth will eventually catch up. And if other things are normal, their lungs should reach maturity. Now, walking through the ICN or the NICU, you can see babies in their incubators because temperature is also something that needs a relatively mature system to regulate. So if they can't regulate their body temperature, they stay in the incubator until they've proven to us that they can maintain their temperature and they can be taken off. In fact, we take them out for a little bit and test to see if the body temperature can stay constant. Now with this low weight, 2.5 kilograms, that's not a lot of fat to begin with. So aside from the central regulation of temperature, they just don't have enough body fat sometimes to stay warm. And then nutrition is obviously a big one. Usually babies, we say they need about 100 calories per kilogram of body weight. So in a lot of low birth weight infants, we actually fortify their formula. Many times they're also they're unable to feed on their own. So we feed them formula anyway, and we can fortify so that we have more than 100 calories per kilogram of body weight, just to help them catch up on the growth a little bit. The growth is everything. I mean, the weight itself will directly contribute to other problems like this temperature regulation. But also, I just said that they often can't breastfeed. So the difference between breast milk and formula, I actually saw these blocks on the hospital floor at one point that helped me understand. So if this is breast milk, maybe the bottom two blocks here, that's all nutrition, electrolytes, the things that we can replicate. But up here, these two blocks are the immune system. Mothers pass a lot of immune antibodies to their children as they breastfeed. So with formula, we can only have the bottom two tiers. This is formula, this is breast milk. This is why there's such an advocacy for breast milk. So if they can't breastfeed, we can do a lot for them nutritionally, but in terms of the immune system, without the benefits of their mother's milk, they're more vulnerable to infections. So infection is a big thing. But also if they have a wound healing then becomes also a nutrition thing. So not only is their immune system compromised, but when they do get an infection or an assault of some kind, they have decreased ability to repair it. So that's a double whammy, and we really want to make sure that infection control is kept very strictly. That's why they make you wash your hands when you go to the NICU, no matter what you're doing. So as they feed and gain weight, in peds you'll see this very often, the growth curve. So if this is time, this is going to be a curve, and people are going to be different curves have different percentiles, and a baby will fall along a certain curve, and we want to make sure that they stay there. But remember, with premature kids, this curve often needs to be readjusted. Say they're 4 weeks premature, so they're a month behind their peers. So when they're 1 month old, they're really actually only 0 months old. So there's a difference between gestational age, which takes into account how premature they are, and then there's chronological age. This is the birthday, the day they're actually independent from their mom. That's the chronological age. But for premature kids, these two ages should be kept separately for a while. When we look at the growth curve, they should be readjusted to their gestational age. Otherwise, they're always going to be falling off the curve. Now, with all these issues, we not only have to take care of helping the baby grow and develop after birth, but we also should know why they are small to begin with, or why they're premature. In terms of being small, there's symmetrical and asymmetrical. Symmetrical and asymmetrical. This is kind of why we measure the head circumference. So for symmetrical low birth weight or growth restriction, their head circumference should be just as under the curve as the rest of their body. In this kind of smallness or growth restriction, it's more likely to be a fetal problem. The baby is more likely to have something maybe genetic, maybe metabolic, some sort of problem in the baby's own body that's making it small. But asymmetrical is where the baby can have a normal head circumference, but the rest of their body is small. And these problems are more likely maternal. They can have maternal diabetes, they can have some sort of vessel insufficiency. Whatever the case, this baby's not supposed to be small to begin with, but the maternal condition has made it that way. Nowadays, hopefully with good prenatal care, we should know the cause for growth restriction before the kid is born. And if the baby has a metabolic disorder or cystic fibrosis, we test for that as soon as they come out. But in general, these different systems to be monitored for in the NICU. But in general, these are the rules for 24-hour observation in the NICU. Make sure they're breathing, make sure they're feeding, make sure they're not having an infection, make sure they're maintaining their body temperature, and in a way just help them bide the time until they're big enough and strong enough to be out of the hospital.